Welcome to SAT2 Career 2.0 online nursing channel. We are discussing important questions for Railway Recruitment Board and Tamil Nadu Medical Recruitment Board Staff Nurse Exam 2019. In today's video, we are going to discuss 25 questions. Please subscribe to SAT2 Career 2.0 online nursing channel if you have not yet subscribed. Also, click the bell icon to get latest notification about new videos. Let's see the first question of the day. An assessment of a client's vocal cords requires indirect visualization of the larynx. Which instruction should the nurse give the client to facilitate this procedure? Option A. Try to swallow. B. Hold your breath. C. Breathe normally. D. Roll the tongue to the back of the mouth. So which instruction nurse should give to client to facilitate the procedure of visualizing the vocal cord? The right answer is option C, breathe normally. The rationale: to assess the function of vocal cords through indirect laryngoscopy, the patient is made to sit in upright position to facilitate passage of the laryngeal mirror into the mouth and is instructed to breathe normally. If patient swallows, the swallowing cannot be done with mirror in place. The procedure takes longer than the time the client would be able to hold the breath, and this action is ineffective. Tongue cannot be moved back because it would occlude the airway. So the right option is breathe normally at the time of visualizing the vocal cords through indirect laryngoscopy method. Question number 2. The nurse prepares the client for the removal of nasogastric tube. During the tube removal, the nurse instructs the client to take which action? Option A. Exhale deeply. B. Inhale deeply. C. Hold a deep breath. D. Pause between breaths. The nurse instructs the client to hold a deep breath at the time of removal of nasogastric tube. The rationale: just before removing the tube, the client is asked to take a deep breath and hold it because breath holding minimizes the risk of aspirating gastric contents spilled from the tube during removal. Inhaling and exhaling deeply will increase the chance of aspiration, and pausing between the breath is ineffective. Question number 3. The nurse caring for a postpartum client should suspect that the client is experiencing endometritis if which is noted. Option A. Breast engorgement. B. Elevated white blood cell count. C. Lochia rubra on the second day postpartum. D is fever over 30 degrees Celsius beginning 2 days postpartum. The client experiencing endometritis will show the fever over 38 degrees Celsius beginning 2 days postpartum period. The rationale is very simple. One of the commonest postpartum infection is endometritis. If fever of 38 degrees Celsius or more persists for more than 2 successive days in the first 10 days during postpartum period, will indicate there is endometritis. Breast engorgement and lochia rubra are normal finding during this period. Usually there will be elevated WBC count during this period of time. Question number 4. Which nursing assessment finding indicates the presence of inguinal hernia on a child? Option A. Report of difficulty defecating. B. Reports of dribbling urinary system. C. Absence of testis within the scrotum. And D. Painless groin swelling noticed when the child cries. The symptom which indicates the presence of inguinal hernia on a child is painless groin swelling noticed when the child cries. The rationale: inguinal hernia is a common defect that may appear as a painless inguinal groin swelling when the child cries or strains. At a time of defecating, difficulty indicates a partial obstruction of the herniated lobe of intestine. Dribbling urinary system shows phimosis. Undescended testis indicated cryptorchidism. Let's see the next question. The nurse is performing an assessment on a postterm infant. Which physical characteristic should the nurse expect to observe in the infant? Option A: peeling of the skin. B: smooth soles without creases. C: lanugo covering the entire body. And D is vernix that covers the body in a thick layer. The right answer is peeling of the skin. This characteristic feature shows that the baby is in postterm. The rationale: postterm infant 42 weeks after gestation exhibits dry peeling, crackled, almost leather-like skin over the body, which is called desquamation. In preterm infant born between 24 and 27 weeks of gestation exhibit smooth soles without creases, lanugo covering the entire body, and thick vernix covering the body is commonly present in the preterm infant. Question number 6. A client with an extremity burn injury has undergone a fasciotomy. The nurse prepares to provide which type of wound care to the fasciotomy site? Option A: dry sterile dressings. B: hydrocolloid dressings. C: wet sterile saline dressings. And D is 1/2 strength povidone iodine dressing. So in fasciotomy, what type of dressing the nurse should do? Let's see the answer. Wet sterile saline dressing is prepared by the nurse in a client with who undergone fasciotomy. The rationale: a fasciotomy is an incision made extending through the subcutaneous tissue and fascia. The fasciotomy site is not sutured but is left open to relieve pressure and edema. The site is covered with wet sterile saline dressings. After 3 to 5 days, when perfusion is adequate and edema subsides, the wound is debrided and closed. A hydrocolloid dressing is not indicated for use with clean open incisions. The incision is clean and not the incision is clean, not dirty, so there should be no reason for using povidone iodine. Also, the use of povidone iodine may cause irritation to the injured area. Question number 7. The nurse creates a postoperative plan of care for a client undergoing an arthroscopy. The nurse should include which priority action in the plan? Option A: monitor intake and output. B: assess the tissue at surgical site. C: monitor the area for numbness or tingling. B: assess the complete blood count result. The nurse must include the priority action for a postoperative plan for who undergo arthroscopy should be option C: monitor the area for numbness or tingling sensation. The rationale: arthroscopy is used to diagnose and treat acute and chronic disorders of the joint. The priority nursing intervention is to monitor the affected area for any signs of numbness and tingling. Question number 8. The nurse assesses a peripheral intravenous IV dressing and notes that it is damp and the tape is loose. What action should the nurse take initially? Option A. Stop the infusion immediately. B. Apply a sterile occlusive dressing. Option C. Ensure all IV tubing connections are tight. D. Gather the supplies need to insert a new IV line. So the important nursing intervention when there is leakage of peripheral intravenous dressing should be ensure all IV tubing connections are tight. The rationale. Firstly, the nurse checks all connections to ensure tight seal while the IV infuses to help locate the source of leakage. If the leak is at the insertion site, the nurse stops the infusion, removes the IV and inserts a new IV catheter. The nurse applies a new sterile occlusive dressing after resolving the source of the leakage. Question number 9. A preschooler with a history of cleft palate repair comes to the clinic for routine well child checkup. To determine whether this child is experiencing a long-term effect of cleft palate, which question should the nurse ask the patient? Option A. Does the child play with an imaginary friend? Option B. Was the child recently treated for pneumonia? C. Does the child respond when called by name? And D. Has the child had any difficulty in swallowing food? The right answer. The question the nurse should ask the patient is, does the child respond when called by his or her name? The rationale, a child with cleft palate is at the risk for developing frequent otitis media, which can result in hearing loss. Unresponsiveness may be an indication that the child is experiencing hearing loss. Option A is a normal behavior, that is playing, making imaginary play at this age is normal behavior. Option B and D are irrelevant to the cleft palate. Question number 10. The nurse is caring for a client who is receiving tacrolimus daily. Which finding indicates to the nurse that client is experiencing an adverse effect of this medication? Option A. Hypotension. B. Photophobia. Option C. Profuse sweating. Option D. Decrease in urine output. The right answer is option D. Decrease in urine output. The rationale. Tacrolimus is an immunosuppressant medication used in the prophylaxis of organ rejection in clients receiving allogeneic liver transplant. Adverse reactions and toxic effects include nephrotoxicity and pleural effusion. Nephrotoxicity is characterized by increased serum creatinine level and decrease in urine output. Hence, the side effect or adverse effect of this medication would be decrease in urine output. Now, let's see some of the psychiatric questions. A person has run away from home, adopting a new identity with complete amnesia about his earlier life. This disorder is known as A. Dissociative fugue, B. Dissociative amnesia, C. Multiple personality disorder, and D. Conversion disorder. The right answer is option A. Dissociative fugue. The rationale. Dissociative disorder includes three types: dissociative amnesia, dissociative fugue, and dissociative identity disorder. In dissociative amnesia, it involves extensive but selective memory loss in which there is no physiological explanation for the forgetting. In dissociative fugue, a disorder in which individual loses complete memory of her identity and may even assume a new one, often far from home. In dissociative identity disorder, also called multiple personality disorder, The presence of two or more distinct identities or personality states are present. Conversion disorder is characterized by the presence of neurological disorder that cannot be explained by any known neurological or medical disorders. Hence, the answer dissociative fugue is right. Question number 12. The most common psychotherapy used to help a person with obsessive compulsive disorder is A. Behavior modification, B. Transaction therapy, C. Abreaction, and D is flooding. The right answer is option A. Behavior modification is used in person with obsessive compulsive disorder. The rationale: the specific technique used to treat obsessive compulsive disorder is exposure with response prevention. According to the given option, the best method to treat OCD is behavior modification. It is used to increase desirable behaviors and decrease undesirable ones. Behavior modification is based on the idea that good behavior should be lead to positive consequences and bad behavior should lead to negative consequences. When behavior modification is used consistently, patients slowly change their behavior. Flooding therapy is used to treat phobia. Transaction therapy can be used to address one's interactions and communication with the purpose of establishing and reinforcing the idea that each individual is valuable and has the capacity for positive change and personal growth. Question number 13. Nurse is caring for a male client who experiences false sensory perception with no basis in reality. This perception is known as A. Hallucination, B. Delusion, C. Loose association, and D. Neologism. The right answer is option A. Hallucination. The rationale: delusion is a fixed, unshakable false belief. Loose association is a thought disorder in which series of ideas are presented with loosely apparent or completely inapparent logical connection. Neologism is coining of new words. Hallucination is a sensory experience of something that does not exist outside the mind, caused by various physical and mental disorders, or by reaction to certain toxic substances, and usually manifested as visual or auditory, or can be gustatory, or it can be olfactory, or it can be a tactile related to senses. Question number 14. Mr. Kapil says that he is the first head of the world and he is born with special mission in life. These are the symptoms of option A. Autochthonous delusion, B. Delusion of grandeur, C. Delusion of persecution, and D is delusion of reference. The right answer is option B. Delusion of grandeur. The rationale: autochthonous delusion is a type of delusion arising without apparent cause. Client suddenly tells without any reason that he is an alien. A delusion of grandeur is the fixed false belief that one possesses superior qualities such as genius, fame, omnipotence, etc. Delusion of reference: patient feels that they are the center of attention, that people are looking at you or talking about you. Delusion of persecution: a delusion that one is being attacked, harassed, cheated, persecuted, and conspire against them. This is delusion of persecution. So here the patient have delusion of grandiosity. Question number 15. Some medical surgical questions. Fever, headache, and knuckle rigidity are classic symptoms seen in option A. Parkinson's disease, B. Meningomyocele, C. Alzheimer's disease, D. Meningitis. These are the classical symptoms of meningitis. In meningitis, the possible presence of bacterial meningitis is suggested by the symptoms like fever, altered mental status, headache, and knuckle rigidity, that is, stiffness of neck. Virtually all patients, 99 to 100%, have at least one of these classic triad. Question number 16. The major criteria for the diagnosis of rheumatic fever include all except option A, carditis, B, fever, C, chorea, D, subcutaneous nodules. So major criteria for diagnosis of rheumatic fever will be carditis, chorea, and subcutaneous nodule. So here ask except, so select the option fever. So this is the characteristic, the criteria for diagnosing a this one, diagnosing a rheumatic fever. So we have the mnemonic Jones Cafe Paul. So major criteria: J, joint involvement. O looks like a heart, that is myocarditis. N stands for nodule subcutaneous. E stands for erythema marginatum, and S stands for Setnam Korea. Our minor criteria we have CRP, increase, arthralgia, fever, elevated ESR, prolonged PR interval. We have anam, anam, anam of rheumatism, and we have leukocytosis. So if any two major criteria, or if there is one major criteria and two minor criteria is present, then we can say the client is having rheumatic fever. Question number 17. To determine the stage of infection of HIV/AIDS, what laboratory tests are taken? Option A, hepatitis PPD. Option B, ELISA test. C, CD4 HIV load. And D is PCR. The right answer is CD4 HIV load is taken to check the stage of infection of HIV/AIDS. The rational and HIV viral load test measures the number of HIV particles in a millimeter of blood. These particles are known as copies. The test assesses the progression of HIV in the body. It's also useful in seeing how well a person HIV therapy is controlling HIV in their body. Question number 18. The period of 12th five-year plan of the Government of India is option A 2010 to 15, option B 2012 to 2017, option C 2011 to 2016, option D is 2013 to 2018. The right answer is 12th five-year plan is between 2012 to 2017. Question number 19. Which of the following organism causes malignant malaria? A. Plasmodium vivax, B. Plasmodium falciparum, C. Plasmodium ovale, and D. None of the above. The agent causing malignant malaria is Plasmodium falciparum. Question number 20. Strategies of rural health mission will help in which of the following? Option A. Enhance capacity of Panchayat Raj institution. B. Reduce MMR. C. Strengthen subsector. And D. All of the above. So strategies of National Rural Health Mission will help in all of the above mentioned strategies. Question number 21. MMR vaccine is given approximately at the age of option A 12 to 15 months, B after 15 months, C at any age, and D 0 to 40 days. MMR vaccine is approximately given at the age of 12 to 15 months. Question number 22. Small nodules observed during 8 weeks of pregnancy on primary areola are known as A. Moscow pregnancy, B. Montgomery tubercles, option C. Arida tubercles, and D is Linear nigra. The right answer is Montgomery tubercles. Question number 23. Which of the following pre-packed STI or RTI kit is used for the treatment of vaginitis? Option A. green color, B white color, C gray color, and D yellow color. The right answer is option C. Green color kit is used for the treatment of vaginitis. So you have the green color kit which is used for treating any abnormalities in the vagina. Question number 23. Some of the GK questions related to railways. Where is the Railway Staff College located? Option A, Pune, B, Allahabad, C, Vadodara, and D, Delhi. The right answer, Railway Staff College is located at Vadodara, Gujarat. Question number 24. The first recipient of Rajiv Gandhi's Khel Ratna Award is option A, Vishwanathan Anand, B, Leander Pace, C, Kapil Dev, and D, Sania Mirza. The right answer is Vishwanathan Anand. Next question. Which of the following is the longest sorry? Which of the following is the longest railway tunnel in the world? Option A, Channel Tunnel, B, Salkan Tunnel, C, Ulayan Tunnel, and D is Gotthard Base Tunnel. The longest railway tunnel in the world is in Switzerland, in the Mount Alps, that is Gotthard Base Tunnel, which is 57.09 kilometer length. Question number 25. Who among the following is known as the father of Indian railways? Option A, Lord Dalhousie, B, Lord Raipan, C, Mahatma Gandhi, D, Vishveshwaraya. The father of Indian railway is option A, Lord Dalhousie. Thanks for watching this video. Please subscribe to our channel to get more information related to RRB and MRB nursing officer exams.